in the first case, we have Dr. Shakuntala Kumar as the moderator. The obstetrician is Dr. Divya Singhal, and the patient's attendant is Dr. Vandna Gupta from DGF North.
Right.
Over to you, Dr. Shakuntala, as the moderator.
Yeah. So all three of us are from North Delhi Gynae Forum. This is a very interesting case. This is about a fresh stillbirth that happens. Actually, the patient has been in a regular follow-up with the Dr. Divya. And she's 30, she's a private traveler for her regular checkup. Mind it, she just come for and when
sorry, Dr. Radhika Sachdev, can you mute yourself? Can
आप अपने को म्यूट कर लीजिए, please.
So when a regular ultrasound is done, an AFI of 5 was found. The patient incidentally was complaining of decreased fetal movement. Dr. Divya does an NST and she finds it very, very non-reassuring. And now she is going to talk to the attendant of the patient, Dr. Divya.
देखिए बेटा, अल्ट्रासाउंड की रिपोर्ट के हिसाब से बच्चे के चारों तरफ का पानी सूख रहा है और उसका जो ग्राफ निकाला है उसमें भी बच्चे को अंदर खतरा है। तो इस समय हमारे को बच्चे को बाहर निकाल लेना चाहिए सिजेरियन से। वैसे भी बच्चा पूरे टाइम का हो गया और हमारे को अब एडमिट करके तुरंत सिजेरियन कर देना चाहिए।
अरे डॉक्टर साहब, आप एडमिट क्यों कर रहे हो? दर्द उठने पर हम आ जाएंगे। आप तो बस चेकअप के लिए आपने बुलाया था, और अगर डॉक्टर साहब एडमिट करना ही है तो नॉर्मल डिलीवरी करा दीजिए। आप ही कह रहे थे सब कुछ ठीक है, और सब क्या हो गया?
देखो बेटा, मैं फिर से बोल रही हूँ, बच्चे का ग्राफ ठीक नहीं आ रहा है। नॉर्मल डिलीवरी में रिस्क हो सकता है, पानी भी कम है, और इमरजेंसी में सिजेरियन करने से बेहतर ये रहेगा कि हम अभी प्लान करके तरीके से सिजेरियन करें।
डॉक्टर साहब, आपका इतना नाम है, आपने तो कई सारे केस नॉर्मल करे हैं। हम तो आप नाम सुनकर ही इतनी दूर से आए हैं। ऊपर वाले की दया से और आपके हाथ से नॉर्मल डिलीवरी हो जाएगी।
Now the doctor listens to this conversation with the patient attendant and she mellows down and she kind of semi-agrees to the request given by the patient.
अच्छा, आप ऐसा करो कि कम से कम लिखित में तो मुझे दे दो कि आप नॉर्मल डिलीवरी करवाना चाहते हो।
डॉक्टर साहब, आप पर पूरा भरोसा है। इसमें साइन का क्या है? ये कागज वागज हटाइए। यकीन मानिए, पूरा भरोसा है। आप जो करेंगे सही करेंगे।
So the doctor goes ahead and starts her treatment. Now what happens is that the next day the doctor is like, she had given a very small dose of syntocinon, but then when the syntocinon is running, she notices fetal distress. She panics and she takes the patient for an emergency cesarean section. Again, an informed consent for a very high risk probably was not taken. Now she unfortunately lands up in a very bad situation, that is a fresh stillbirth. Now the obstetrician is absolutely shaken, very, very upset, and now in the same condition, usi halat mein, she comes out in front of the patient's attendants alone, and then she breaks the news. Dr. Divya.
भाई सुनो जरा, इधर सुनो। देखो, मैं आपको कुछ बताना चाह रही हूँ। मैं आई एम सॉरी, रियली सॉरी, लेकिन मैं बच्चे को नहीं बचा पाई।
क्या? ये क्या कह रहे हो डॉक्टर? अभी तक तो सब ठीक था। हमने तो धड़कन भी सुनी थी, धड़कन तो ठीक चल रही थी। ये क्या हो गया?
मैंने आपको कल भी बताया था कि सिजेरियन करा लो, आप नॉर्मल डिलीवरी के पीछे पड़े रहे।
अरे डॉक्टर, ये आपने कैसी बात कर दी? ये थोड़ी ना कहा था। आपने तो हमारे बच्चे की जान ही ले ली। हमारा बच्चा मर गया। अरे कोई है? अरे कोई सुन रहे हो? इन्होंने तो, डॉक्टर ने तो हमारे बच्चे को मार दिया। अरे हमारे बच्चे को मार दिया, हमारा बच्चा मर गया। कोई सुन रहे हो?
So there is collection of a mob. The doctor is beaten up and is accused by other people who were not there at the time of counseling of murder. Now let's hear the right way of handling this case. Now what happens? The doctor sees the ultrasound report and she sees that a non-reassuring CTG is there. She just puts her foot down and she takes an immediate action. She is just not letting the patient say or command on her कि normal delivery कर दो मेरी या cesarean कर दो. She has taken the whole situation in her hand and very confidently she asks for an informed consent. Dr. Divya.
इन्फॉर्म्ड कंसेंट साइन.
देखिए, अगर आप बच्चे को और सेफ चाहते हो तो सिजेरियन के लिए अभी साइन करना पड़ेगा और बच्चे की कंडीशन बिल्कुल ठीक नहीं है, ये बात आप समझ लीजिएगा. ये ठीक से समझना बहुत जरूरी है कि नॉर्मल डिलीवरी या ट्राई ब्राई करने का बिल्कुल कोई मौका नहीं है इस वक्त. इस समय इमरजेंसी सिजेरियन अभी करना चाहिए अगर आप रियली चाहते हो कि हम बच्चे को बचाएं.
So the doctor has taken a very, very informed consent from the attendant of the patient. Witnesses are around. She knows who are the people who are decision makers of the family. She calls them around and she makes sure that she has taken an informed consent and then she proceeds with an emergency cesarean section. But lands up in a fresh stillbirth. Now, the doctor understands that a fresh stillbirth has happened. She speaks to the pediatrician, the anesthetist. All of them, they have tried their best to resuscitate the baby, but unfortunately this incident has happened. Now, taking all the doctors along, she comes forward. She is the captain of the ship. She is standing with all the doctors and the whole team. And now she speaks to the attendant of the patient.
देखिए भाई साहब, ऑपरेशन ठीक ठाक हो गया है, आपका मरीज ठीक है, लेकिन बच्चे ने अंदर पॉटी कर रखी थी और उसने गंदा पानी भी पी लिया था. इस वजह से बच्चा बाहर आने पर सांस नहीं ले पाया.
मैडम आप क्या बोल रहे हो? हमारे बच्चे को क्या हो गया है?
In the meanwhile, the doctor had informed the police also, anticipating any kind of undue circumstances or any, mob violence. She had anticipated and she had informed the local bodies as well. And she had informed her local medical association as well as some people from Indian Medical Association in the meanwhile have also gathered.
देखो भैया, हमने अपनी पूरी कोशिश की, हमारे साथ पूरी टीम थी, बच्चे के स्पेशलिस्ट, वेंटिलेटर तक था और एनेस्थेटिस्ट सबके सब लगे हुए थे बच्चे को रिससिटेट करने में कोई कमी नहीं करी. और हमारे पास हर टाइप की मशीन है, हमने सब कुछ ट्राई किया, लेकिन बच्चा सांस नहीं ले पाया. उसने बहुत ज्यादा पॉटी अंदर ले चुका था, तो इस वजह से हम बच्चे को नहीं बचा पाए. अब आप समझ हम क्या करें?
मैडम हम लोग ने बड़े बच्चे तो
मरीज ठीक है, वो यंग हेल्थ है, यंग एक बच्चा हेल्दी बच्चा डिलीवर कर पाएगी, उसमें ये क्षमता है. आप पॉजिटिव रखिए अपने को, अपनी सोच को.
So the doctor has done accurate grief management. She has consoled the attendant. She has taken care that she is not attacked in the whole process, and she has given right counseling to the attendant of the patient.
What about the postmortem of the child?
So we asked the attendants if they would like to get a postmortem done, and the patient refuses, the attendants refuse, but yet we insist on it that postmortem होना चाहिए कि भाई आप लोगों को सही कारण पता रहे और वो डॉक्यूमेंट हो जाए कि वाकई में बच्चे ने पानी लिया था कि नहीं. ये तो हम ही बोल रहे ना, तो आप लोग ये अंडरस्टैंड तभी कर पाओगे जब ये डॉक्यूमेंटेड एविडेंस आपके पास हो जाएगा. तो इसलिए आप पोस्टमार्टम जरूर कराइए.
However, the attendants refused and a consent was taken that they did not want any postmortem of the fresh stillbirth baby that had happened.
Madam, your comments.
There should be definite documentation on the file by the treating doctor that postmortem is must to know the cause. So that particular part, she should before even talking to them, she should definitely put down the postmortem should be done. So it should be on her documentation. There's no if and but. There has to be there.
Right, ma'am.
I have a question. Ma'am, can I add one thing in this?
Please.
Actually, I wanted to add one thing, that whenever you are taking consent of a meconium patient or anyone, I think you should you should advise her, or you should counsel her for the risk of IUD and the SB at the same time also. Like if the baby is live now, but you do not know there are chances of 10%, 5% or whatever of SB baby may deliver, or the baby may die soon after the birth, maybe 1 hour, 2 hours. We do not know the amount of meconium he or she has already taken into the respiration. That can only be decided after the birth of the baby, which we cannot even predict right now. So that consent has to be taken at the same time whenever you are taking the consent of the cesarean. And if the patient and relatives are ready on that, then only you can ask and go ahead for cesarean. Otherwise, you may land up in a new problem, that you have done the cesarean, and even then you could not save the baby, because we are doing cesarean here for the baby, not for the mother's sake.
डॉक्टर के गले में ना हड्डी होती है इस समय, क्या है, इट इज अ बुक्ड पेशेंट एंड सडनली डॉक्टर हैज रियलाइज्ड दैट देयर इज एन AFI ऑफ दिस मच. अब वो अगर मान लो सिजेरियन के लिए रिफ्यूज करती है, कहीं और भेजती है, और वहां जाके कहीं कुछ और 2-3 बातें डॉक्टर्स बनाते हैं जो
मैम वन पेशेंट चला जाएगा, दैट इज ओके. मैम वन पेशेंट, अगर सारे डॉक्टर्स if we take the same stand at each and every time, then after some time that the patient, yes, then patient will try to understand
कि सब एक स्टैंस नहीं लेते हैं.
मैम कोई बात नहीं मैम, एक पेशेंट जाने दीजिए. हाँ,
Doctor, I would like to chip in. Just like vaginal delivery after cesarean section, there should be uniform consent should be taken around 34 weeks or so. It should be given to her. It should be put on a file that, we have given a consent. Please make up a decision. And similarly, I think Amita's suggestion is absolutely great, because I think if you recall back your own meconium cases also, that, when you do a cesarean section, you have to tell them, we are doing it, but still it can happen. The meconium and sudden drop of lichen is not by us. It is not Dr. Jain created, or not Dr. This thing is created. But you must tell them about the cesarean section, that I have explained to you that in spite of the cesarean section, there is a 10% of chance that it may be stillbirth, and we may lose the baby in immediate neonatal period. I think she's absolutely right.
Yes, ma'am, agree.
Because ma'am, you may lose one patient, but you will save yourself forever. Ma'am, it is, yes ma'am. Yes, ma'am. It should be documented that it has been explained to the patient in his or her language that there is still chances of baby death in just immediate after birth or in the neonatal period.
Yes, Dr. Amita.
It should be written. Yes.
Or also added neurological handicap also can be mentioned.
Sorry. One by one.
Neurological handicap also, because the baby may survive, but could have HIE 1, 2, 3 like that.
Right.
That also we have to explain, because
actually now we have to get out of our cages or out of our cocoons and explain all the complications that can take place. हम लोग डरते हैं complications बताने के लिए उस समय जिस समय हम लोग शुरू करने वाले होंगे सिजेरियन या लेबर, और हम लिखवाते पेशेंट पे, हम कुछ भी नहीं लिखवाते, सिर्फ सिजेरियन का फाइनली ये कंसेंट लेते हैं, दैट इज ऑल. तो
I want to say what we do in our hospital. I think some noise is coming from somewhere. Like what we do is we take an informed consent for a cesarean section where everything is written for them. 1. 2, if you think it's a high risk pregnancy, as far as the baby is concerned, whether it's an extreme prematurity or any kind of a malformation or something, we take a separate consent where we tell them that this is a preterm baby can have birth asphyxia, strain NICU, ventilator, asphyxia, whatever. I even write down this might lead to a lot of expenditure also, So 1, we take consent apne aap alag se despite a cesarean section. And if there is a high risk condition of the mother, even at the time of admission, we take that high risk consent and we repeat it maybe after 2 days, 3 days, because that consent in that situation is for that day, If you have to situation changes every day, then you please take consent every day, means you have informed, and let them write. Okay. And the third thing is we call our neonatologists for their counseling. Like a premature baby, if you are doing it, so you call your for any heart disease or any renal disorder or any kind of a disorder. If you have an antenatal, we can form a team, or if you can't form a team, you can send it to your neonatologist and document in your papers. So what we do is we take a neonatologist counseling also, which they have a detailed counseling. So, I have a case in the DMC, which is a 24 weeks and 5 days twins, So the problem of him is the one who survived, why this baby survived, and the one who died, why that baby died. So where I have taken a consent, not only for the delivery, for an extreme premature baby, everything has been written. And even it has a written like, I'm not willing for a cesarean section. And I do understand at 24 weeks and 5 days, my babies while doing a vaginal birth can have a severe birth asphyxia and an intrauterine death. And the baby might suffer from the chances of suffering from a baby to a mental and physical disabilities are very, very high. I have also done it. Neonatologist has done it. The person says, I just went with the flow. So the answer was you went with the flow once, but you can't go twice. You can't go thrice. The most important thing is right date and time. So you can go with the flow once, but you can't go with the flows 2-3 times. So my request to everyone is please don't think that your cesarean section is complete. Another piece of a paper, just write completely on your progress sheet and please number it. You have to number each and every paper. For example, if you are doing a mid-trimester abortion for some kind of a congenital malformation, please take your, ultrasound paper, the report, and paste on your progress sheet. The loose sheets can, somebody can remove it from your file or something. But if you paste on a progress sheet, put a number. This will never be taken from your file.
Thank you.
This we are doing it from last 15 years because what we have realized, because file is not in your hand. Sometimes the file is not complete. Sometimes the papers are not complete. And this is a request for everyone. All papers, whether there is a previous surgery or there is no previous surgery, please, sometime the patient comes, like for example, please don't mention this laparotomy because for some another disease 10 years back, because this is not insured. I'm very clear. If you have a scar on your tummy, this has to be mentioned. They tell us again and again, don't do it. I said, choose another doctor because as per law, as per MCI, as per my hospital, I'm not allowed to do these kind of illegal stuff. You say you lose a patient, but that's better you lose a patient.
Yeah, thank you.
I fully agree with you. We are
another very
the same thing in our hospital also.
Yeah, another very important thing, Dr. Leena, I don't know, but we have learned with our experience. Look, Max has everything on HIS. You don't have, all the hospitals have nothing on HIS. Please maintain an antenatal card.
Dr. Shashilata Kabra wants to say something.
So please maintain an antenatal card. All your prescriptions, all your investigations should be photostat and should be filed in every file, whether she is admitted twice or she admitted thrice. That time patient will give you everything. Later on, if you ask for any of your paper, it won't be given. And please, once the patient is admitted, next day when you go for a round, just make sure your antenatal card is there and your prescription is there. Sometimes for example, in one case, you have written fibroid. The next time she came, you have done something else. And the third time, you write myomectomy or a hysterectomy. At the time of admission, you have only last prescription there. So the patient can tell you have not done any alternative. So make sure your everything is filed.
Thank you. Thank you very much, Dr.
Can I ask a question, please?
May I ask?
Dr. Shashi Kabra, please give your input, Dr. Shashi Kabra.
Yes, thank you, Dr. Divya. and it was very nicely explained by you, Dr. Anjala also. So the first thing is the documentation, that is very, very important. And regarding documentation, I can say that only proper documentation. Any condition of the mother or the fetus, that will save you in the court of law. The thing is that we, as she has described, that we need to take separate consent form for other elements. So I tried to mention that recently I made a standard operative protocol. We should have a SOP, standard operative protocol for our own labor room. So I have made a standard operative protocol for my own DDU labor room. And there is not only one or two consent. I have added 40 consent forms. It is for previous cesarean, it is different. It is for normal cesarean, it is different. For preterm delivery, it is different. For breech delivery, it is different. For outside delivery, it is different. For oligohydramnios, polyhydramnios, preeclampsia, everything. So I can share those consent forms with everybody in DGF. So that will really help.
Yeah.
That will be great.
Sorry, I just want to add one thing also. I've learned from my experience. Just a minute, Amita. I just want to say, because these things we have learned over the time, there's just two more things. For example, you have done a TLH and you wanted to discharge your patient, and after 2 days, your patient says, no, I don't want to go home, So you have, please write that kuch bhi likh do. Patient was feeling little weak, or the patient was having a headache, doesn't want to go home today. Please mention. Okay, for example, the mother has a preterm delivery. She doesn't want to go home after a day or so. Please mention that patient advised discharge, but patient doesn't want to go home because she wants to stay near the baby for the next 24 to 48 hours. The same case has told me that I have kept her in the hospital unnecessarily, Whereas if you look into the documents, I have written that she had PPH, 1 placenta was retained. So I kept her for an IV antibiotic for 48 hours. And after that, I have written there that patient is fit to go home, patient advised discharge. And niche I have written, patient wanted to stay near the baby, so doesn't want to go home. Will ask the husband and let you know. And husband disappeared for 48 hours and she didn't go. Again, I have written after 48 hours, she will ask the husband and let me know. So, even that challenge has gone. Abhi to that case is going on, but that challenge that I have kept her unnecessarily in the hospital has also been ruled out because I have mentioned.
Excellent.
So please don't go by what patient tells you. You write down every day. He doesn't want to go home because she's feeling low. He doesn't want to go home, she is feeling low. Because once they do a case on you, they will tell you have kept her in the hospital unnecessarily.
So excellent points, Dr. Angela. Thank you so much for coming back to Dr. Shashi about her consent. So she is going to share her consent forms with us, and we are going to give them on DGF platform. I want coming back to the consents.
Ma'am, one point.
Let Dr. Shashi, you take charge of 2-3 private practitioners from the distinct hospitals. Make a common forms, and then only we'll distribute.
Yes, ma'am.
Ma'am, one thing I want to add, that the already printed consent forms are not allowed as a consent form. Consent should be taken in each and every case individually. In the written, better to be taken in the patient's handwriting. But if it is not possible to take in patient's handwriting, then it should be written by the person who is taking the consent, and it should be written at the same time that it is made that the patient was made understand in his or her language. So it should not be the pre-printed consent forms are challenged.
No. Doctor, you can have printed form that has a column.
And name should be written. Name of the patient should be written.
नहीं अमिता वो हुआ है. अगर आपके कंसेंट फॉर्म्स में आप हमारे हॉस्पिटल के कंसेंट फॉर्म्स देखो, उसमें प्रॉपर प्रिंटेड है और उसमें 5-6 लाइनें होती हैं कि
मैम अब नया कुछ ऐसा आ गया है अभी 2-3 में हुआ है. मैम एक बार कंफर्म कर लेते हैं इसको. वी कैन डिस्कस इट.
शर्मा ने बताया.
Listen to Dr. Shashi.
No, I think this was very clear. Dr. Gitendra also mentioned that we can use
there is a consent.
Yes,
there is on a website
specific
for you is available.
Yes.
मैम मैं बताना चाहती हूँ.
Can I chip in for a couple of things? I think there had been a question. Dr. Angela's inputs have been absolutely great. I think one should have a detailed kind of a thing, and a neurologist, neonatologist consultation should be there. Not only he's going to brief about the neonatal outcome, but he was also going to brief them about what will be the charges of the nursery and things like that, and referral will be there. I think that particular part should be there. You also mentioned, many patients say that Doctor Sahab, hum jana nahi chahte. Koi baat nahi, hamari taraf se aap discharge hai, and you can stay on till the time you want to stay. We will not be making any visits to you. So people like me definitely write down from my side, the bill has been made.
मैडम मैडम आप ऐसा भी नहीं कर सकते. अगर पेशेंट हॉस्पिटल में आपके अंडर एडमिटेड तो आपको उसको विजिट करना ही पड़ेगा.
डॉक्टर साहब अगर वो नियोनेटोलॉजिस्ट के पॉइंट ऑफ व्यू से रुकते हैं तो हम लोग विजिट नहीं करते. डॉक्टर साहब
नहीं डॉक्टर साहब
नियोनेटोलॉजिस्ट नहीं,
हम लोग क्या करते हैं, उसको मदर को एज ए ब्रेस्ट फीडिंग मदर करके हमारे से डिस्चार्ज होती है और वो हॉस्पिटल में रहती है, बट वो मेरे अंडर एडमिटेड नहीं होती. लेकिन एज पर लॉ अगर पेशेंट आपके अंडर एडमिटेड है तो आपको उसको हर रोज देखना पड़ेगा.
So the message from all these discussions.
Just let me say what Dr. Ahuja is saying. You can read the patient as under the neonatologist, where she is as an attendant. The lady is as an attendant. The primary patient is the baby. Then you can.
So she can stay there as a breastfeeding mother. Another suggestion, just to save yourself.
Dr. Amrinder had asked about, that big hospitals, whenever there is a death happens at a big hospital, all those people, they are definitely there. But the person who explains the case is the person who is treating the case should explain. And, it should not be given to anybody else. Like head of the department comes and Angela's case is there, so Angela should be able to speak. And head of the department is only give them a support. Because they do not know anything about the case. I think, the support system comes, as Dr. Shakuntala says that, 8-10 doctors of the staff and the senior doctors come around it, but the explanation is done by the person concerned. So I think, and yes, there is a policy. If something goes wrong, the hospitals normally terminate those people and ask them to resign. Oh, that's a kind of policy which definitely goes on.
Dr. Deepti Sharma, please mute yourself. Please mute yourself.
To allow me,
Yes.
Divya. Yeah,
Yes.
so the thing is that somebody has raised the question that they should be written in own handwriting only. I want to clarify here that they can be printed, there is no problem. And the signature of the patient, the treating doctor, and one witness should be there. And the thing is that it should be written that it has been made understand to the person in her own language. That is most important.
Shashi, for this, if you just write down one line on each page, I have read and understood, your purpose is solved. She will write herself, I have read and understood and signed. Iska matlab usne sara padha hai. There is another Dr. Shenoy who has the medical legal and he has also given us these tips. Our residents will get. Another very important thing which I want to tell all the private practitioners. One, the letter for leave. Another is a fitness certificate. Please don't give on OPD slips. Tell your hospitals to make a printed copy for it which has a serial number. If everybody will do that, the hospital keeps that for a record. Your OPD records are only there for 3 months. If somebody tells you have not given them a leave or you have given them unnecessary bed rest or something, so that is a very documented serial certificate. So please
We've been doing for a long time. This every doctor has to do it.
Please make a serial book for you, even in the hospital or a nursing home. Make sure that everybody writes on that.
So, and one more thing.
Very high risk patients, they have an in-camera meeting in some hospitals with these people who cannot understand what's written. So there everything is recorded. The medical superintendent, the concerned specialist, and like the neonatologist or someone. So that is also a recorded situation that everyone knows.
Yeah, and one more thing regarding PPH, the documentation is very, very important because the death occurs earliest in this case. So I have already made one documentation pro forma And that serves as a checklist also. So I will share that too with everyone so that no mistake can be done in the management of PPH. And if your documentation is proper, then nobody can ask you anything. Nobody can give you any punishment in any court of law. Death may occur in PPH in spite of all efforts. This is the message. But we are trying our level best to prevent it.
Dr. Shashi, you have to sit down with 2-3 private practitioners. We will let you know who. And then finally make a documentation and then we hand it over to these people. But one thing is, I think the time has come. The time has come that any delivery which takes place, you must give them a paper that in every delivery there is a risk of losing a life. If you're not prepared, you can definitely change the doctor, you can definitely change the hospital, and everywhere the person should definitely give the same. Because they must know that there is something, whatever small incidents may be there, but there's a chance that untimely things can crop up suddenly out of the blue and she can lose her life. So I think this particular part, I think should be, मेरे को लगता है कि हर हॉस्पिटल के बोर्ड में लगाना चाहिए कि हर डिलीवरी में डेथ का रिस्क है.
Yes.
कभी नहीं तो ये वाला तो जरूर बोर्ड में लगाना चाहिए. जैसे हमारे को ये पुलिस का लगाना है कि ये वाला लॉ है, एक हम फ्रंट में लगाएं और एक बाहर लगाएं, और उनको पता होना चाहिए कि आप डॉक्टर को हाथ लगाओगे तो आपको 3 साल की जेल और आपको जुर्माना होगा और ये बेल भी नहीं होगा. तो ये वाली बात उनको 2-3-4 जगह पे दिखनी चाहिए, एक गेट के और रिसेप्शन के ऊपर. और दूसरी चीज ये वाली भी चीज दिखानी चाहिए, कोई भी डिलीवरी के केस में क्या अनटुवर्ड प्रॉब्लम हो जाएगी, क्या डेथ हो जाएगी, ये वाली कंसेंट जरूर लिखी होनी चाहिए.
मैम पीपीएच की भी कंसेंट होनी चाहिए, आई थिंक,
बिकॉज़ पीपीएच अनप्रेडिक्टेबल होता है.
एमनियोटिक फ्लूइड एम्बोलिज्म कुछ भी कह दो डॉक्टर साहब उसमें तो. और एनएसएस भी डेथ जो है कई बार हो जाती है डॉक्टर साहब, कितना कुछ ना भी कुछ कहो.
There is one
regarding CTC.
मैडम आप आइए लास्ट में वो सेल्फ हेल्प ग्रुप वाला. Madam, let me just tell you here, all of us require protection. Dr. Divya, I was surprised that particular day when she told me in North Delhi and that side of 300 people have got together, and जब भी कोई emergency हो जाती है 30-40 डॉक्टर इकट्ठे हो जाते हैं. So let Dr. Divya and other doctors should say how they have organized and how we should organize. Dr. Divya.
Divya, you must tell us this. This is very important for us.
Yeah. So we have these aspiring young budding doctors. We have Dr. Anupma Gupta. She's an established laparoscopic surgeon, and she's the founder member of this group, and it's actually working. It has shown results. Over to you, Dr. Anupma Gupta, to share your points.
Thank you so much, ma'am. And a very good afternoon to everybody. Ma'am, actually what happened was we as clinicians, all of us know the significance of documentation, how to face a case when it is filed in court, but that is the normal way of doing it. Problem arises when you are alone and a mob surrounds you. What then? सोचना बंद हो जाता है, समझना बंद हो जाता है, क्या करें वो नहीं समझ में आता. उस वक्त the only thing you need is physical support, morale boost, and some people standing by your side saying we are with you. उस वक्त बच जाएंगे तो कोर्ट के अंदर संभाल लेंगे, इसमें कोई डाउट नहीं है. We all have professional indemnities, we all can pay the lawyers, we can fight the case. लेकिन उस वक्त जो सीन होता ना, उसको टैकल करना किसी के लिए भी बहुत मुश्किल हो जाता है. 1 person against 50 people, So this with this in mind, and everybody realized this point कि अब unite हुए बिना there is no other way to it. So we are approximately 450 doctors in Northwest Delhi, in Rohini, Shalimar Bagh, Pitampura, and Begumpur and Sector 24. So all of us had formed initial help group. This was a self group. The message was very clear. Help is a two-way street. आज अगर आप सोचते हैं कि आप घर पे बैठे रहेंगे जब दूसरे के साथ हो रहा है, तो जब आपके साथ होगा तो कोई नहीं आएगा. So make sure that you are coming down when somebody asks for help. Now, 256 people then increased to 450 people. How do we manage that? Because बहुत random हो जाता है कि Sector 24 से call आया and people from Ashok Vihar are rushing. सो वो तो सारा टाइम ट्रैवलिंग में निकल जाएगा एंड बाय द टाइम यू रीच तो उसका कोई मतलब नहीं रह जाता. दैट इनिशियल golden 15 minutes are lost. So then we divided this health group into 4 zones. Now these zones have a primary relevant point is it should be 2 to 3 kilometers radius. So we know that we can reach within a span of 15 minutes. So each of the zone is having approximately 100 or 150 doctors. It is well understood कि हम सब लोग बहुत busy branches से हैं. Not everybody can reach every time. But if 150 people are called, 30, 35 or 40 will definitely reach. That is the point. And every time the zone coordinator makes sure who all have come. आप एक बार नहीं आएंगे, आप 2 बार नहीं आएंगे, आप तीसरी बार भी बिजी थी, लेकिन आप 5 बार बिजी नहीं हो सकते. Then you need to check out, whether you want to stay in the group as an active member or not. Now, how this group works? Suppose I am the primary person who's having a problem. हम लोगों ने एक लिस्ट विद फोन नंबर्स हर एक के पास दिया हुआ है which is to be copied and kept on table top and given to your assistants, your receptionists, your staff, whosoever is there. Because कभी ऐसा इंसिडेंट होगा तो आप फोन पकड़ के कॉल्स नहीं कर सकते. This would not happen. You can make maybe 1 call or maximum 2 calls and that's it. इस वक्त आपका स्टाफ है जिसको पता है कि मुझे इन 5 लोगों को कॉल करना है और वो लोग बात को संभाल लेंगे. Once the call reaches any one of these 5 people from that respective zone, उसके बाद चेन रिएक्शन शुरू हो जाता है. उस पर्टिकुलर जोन के हर एक बंदे को पर्सनली कॉल किया जाता है टू रीच दैट प्लेस एज सुन एज पॉसिबल. और मेन ग्रुप में मैसेज कन्वे किया जाता है कि अगर थिंग्स गो आउट ऑफ हैंड एंड द रिस्पेक्टिव जोन पीपल कैन नॉट हैंडल इट, देन रेस्ट ऑफ द जोन्स आल्सो हैव टू रश. So once this starts, see, there have been so many incidents. I'll just tell you one incident. There was a problem with some pediatrician in a small nursing home. Now the patient was a young boy. बिहार से लेकर आए थे, निमोनिया का ट्रीटमेंट चल रहा था, बेबी was very sick. Admission के टाइम पर it was explained कि we cannot handle, it is 80% saturation, please take it to a higher center. उस वक्त सब लोग समझने का करते, हमको समझ में आ गया, हम रिस्क लेने को तैयार हैं, हम आगे नहीं जाएंगे, साइन भी कर देंगे. सब कुछ डॉक्यूमेंट हो गया, एवरीथिंग इज इन ब्लैक एंड व्हाइट. बेबी डाइज, 1 घंटे के अंदर बच्चा का डेथ हो गया. 5 पीडियाट्रिशियंस वहां पे बेबी के साथ लगातार लगे हुए थे एंड एवरीबॉडी वाज वाचिंग दैट. मतलब अटेंडेंस को बहुत अच्छे से पता था कि वो एक होपलेस केस लेकर आए हैं और डॉक्टर्स पूरी मेहनत कर रहे हैं. बट वंस दैट हैपेंड, पता नहीं कहां से 40, 45, 50 पीपल जस्ट केम एंड दोस 5 pediatricians were very, they were scared and they raised an alarm. And within 10 or 15 minutes, local हम जितने लोग थे, we were around 45 doctors, we reached. हमारा प्रिंसिपल, हमारा एम एग्रेशन नहीं है. वी डोंट वांट एनी वायलेंस. हम वहां पर लड़ाई करने नहीं जा रहे हैं. वी आर जस्ट अ ह्यूमन शील्ड, नंबर 1. नंबर 2 इज वी आर लोकल डॉक्टर्स. हमारे बहुत सारे पेशेंट्स हैं, हमारे बहुत सारे कंटैक्ट्स हैं. मेरे 5 कंटैक्ट्स हैं और 35 लोगों के 5-5 और हैं. फिर हमारा स्टाफ है जो वहीं पर रहता है, जो लोकलाइज को बहुत अच्छे से जानता है, जो उस मॉब में से कम 4 या 5 लोगों को जानता है. जब हम लोग वहां पे जाते हैं तो हम अपने स्टाफ के साथ जाते हैं, whoever is available. वहां पे we try breaking the mob into smaller pieces and pacifying them. मैं इसको जानती हूँ, इन 5 को अलग करो. Don't let them get together. जो अपना डॉक्टर है, तो 5 pediatricians का टीम है, उनको अंदर वाले कमरे में लेकर let them not face the mob at present. Let the things cool down because वो सामने पड़ेंगे तो definitely aggression होगा. Give them time, give the mob some time to digest that, to accept that something has happened, उनके लिए भी it is a very emotional moment and sometimes it is not the parents, it is not the direct attendants who create a ruckus. Usually ruckus वो लोग create करते हैं जिसका कोई लेना देना नहीं होता. Somebody, पड़ोसी का पड़ोसी, nothing better to do, they come down and do that. So ऐसे में जब हम local doctors वहां पे होते हैं, so we have got, somebody knows the SHO, somebody knows somebody. So we are there. People realize they cannot touch the doctors. And the message is very clear कि अभी आप touch मत कीजिए. If you think something wrong has happened, you're free to file a case. But अभी violence नहीं. And this is such a morale boost to the doctors. उस वक्त कई बार as you said, documentation is important. इस वक्त documentation भी नहीं सूझता है. The state of mind is such कि दिमाग काम ही नहीं करता. So out of this 14 doctors, 5 of them will just go with the pediatricians, look at the files, tell them what can be done, how to break the news, stand with them, and the matters are taken care of. And since past 2 years, we have had almost 20 to 25 such violent episodes in our area, and touch wood, all of them have been dealt with very nicely. सब जगह डॉक्टर्स को खरोच नहीं आई. Ultimately, attendance specify होके चले गए. Not a single case was filed. Not a single doctor was assaulted. So that is the crux of the matter. That is how we are functioning, and I would love to give further details on how we intend to go about it in future as well.
Thank you, Anupma. And suppose everybody wants to form a group. First, you hold a meeting of all your doctors, which should also include doctors from other specialities besides gynae. So you should have doctors from IMA, you should have doctors who are pediatricians, anesthetists, everybody, GIT specialists and everybody. Now you formed a group. So what you do is that you first convince them that it is required, and I think these days everybody is kind of ready to to be united. So then what happens is a list of doctors is formed in a WhatsApp group. Now suppose I have a problem. So there is a chain. I am supposed to only dial 2 doctors, the number of 2 contacts. Now these 2 contacts will in turn call 4 doctors each. So now those 4 doctors will again call 4 doctors each, and that is how the chain is activated. Now once what happens is that, and I will also dial 100 number. If I am unable to do so, my staff should be told to dial 100 number, and we should already have an association and friendly kind of relations professionally with the beat officer, with the sub inspector of our area. ये करना पड़ेगा, and हमारे counselor को भी जानना चाहिए. So you call up the counselor, you call up 100 number, you call up your doctors, जो 2 जनों को करना था, and a number of doctors come to help you. The police also comes eventually, and there are other IME doctors, the politician or the activist who has come. So there is so much help, like Anupma said. We should also keep bouncers. ये बात चल रही है कि bouncers होने चाहिए, guards होने चाहिए, तो civil dress में, लेकिन वो आपको physical violence से बचा ले. Can वो थोड़ी सी
एक बात छोटी सी, in fact 2 things I would just like to add. Over a period of 2 years, how we improvised was, हर एपिसोड को वहां पर खत्म मत करो. जब हम पीजी थे तो हमारी मोडालिटी मीट्स होती थी. आफ्टर ईच एपिसोड हमारा जोन के सब मेंबर्स मिलते हैं. दिस इज अ क्लोज मीट बिटवीन डॉक्टर्स, एंड वी इंट्रोस्पेक्ट वेयर वी वेंट रॉन्ग, what should have been done, and how extra could we have helped our colleagues. So we keep doing better for ourselves. And as the recent unfortunate episode occurred, in Dosa, Dr. Archana के साथ जो हुआ, that was a really shocking one. अब हमने अपने हेल्थ ग्रुप के अंदर एक टास्क फोर्स ऐड की है. Now this task force does not include only the gynecologists, because सिर्फ gynecologist की जरूरत नहीं पड़ती. We have surgeon, we have oncosurgeon, we have vascular surgeons, we have anesthetists, we have critical care people, and the concept is very clear. हम आपके alternative consultants नहीं हैं. We are not freelancers. Call us when you know this is a do or die situation and you need all hands on deck, and everybody will come to help. So now there's a team. आपका PPH है, your critical care person is there, your hematologist is there, your vascular surgeon is there, 2 extra pediatric anesthetists are there. You have so much help. So now it's suddenly, you know how to handle things, and you're in a better situation. So this is something, I think it's an ongoing process. Every episode will teach us something. हर बार कुछ बेहतर करना है. This week, as Dr. Divya suggested, we are planning to hold a meeting with local beat officer, SHO, and other police personnel, so that we convey our point of view to them. So the next time we reach out to them, they understand it's they understand our point of view. So police is no more anti-doctors; it becomes pro-doctors as well. So
yes, Doctor.
Yes.
And another point is that when you go to help a doctor, stand by a doctor, don't judge her. Don't start talking कि इसको तो ऐसे कर देना चाहिए था, इसको ऐसे कर देना चाहिए. There is no time to be wasted at that time. You have to be totally with the doctor, standing with the doctor, pro doctor. There is no time to be wasted on judging the doctor. So,
yeah, so very nice. Yeah. Not be judgmental, but be by their side.
Dr. Anupma Gupta, I want to ask you, आपको initial hurdle क्या आई?
इनिशियली तो ऐसा लगा कि कुछ लोगों ने सिर्फ एंथुसियाज्म में ज्वाइन कर लिया व्हाट्सएप ग्रुप, सब ज्वाइन कर रहे हैं, नया ग्रुप बना है, हमको भी ज्वाइन करना है. कुछ दिनों के बाद गुड मॉर्निंग मैसेजेस शुरू हो गए, जैसे कि हर एक ग्रुप में होते हैं. तो वी रियली हैड टू कट देम शॉर्ट. We told them very categorically, the moment any message, apart from the message regarding the spirit of the group was posted, there and then we used to object कि ऐसा कोई message इस group में नहीं आएगा. You have 100 more groups to say good morning to. Do not dilute this group at least. That was number one. After every 3 incidents, we used to ask the people who were not coming to our group, to help the people. Why you did not come? You have to explain. You have to explain your absence. You cannot say कि मैं घर पे, हर बार आप busy नहीं थे. अगर आप नहीं आएंगे तो अगली बार आप कैसे expect करते हैं कि 30 लोग आपके लिए भाग कर आएंगे? We are in this all together. So this was the initial part. मतलब. So now everybody, those who do not agree with the group, have already voted out. Now we all have same spirited people and everybody knows that they have to be on their toes. And it is not an everyday happening. मतलब महीने में अगर एक बार कहीं जाना पड़ता है इमरजेंसी में, we leave our OPDs there and then. We just go. This is how it functions and it is functioning fine because हम सबको अब ये realize हो चुका है कि अगर अभी नहीं किया तो कभी ना कभी सबके साथ यही होने वाला है और कुछ नहीं होगा. हम लोग बहुत छोटी डॉक्टर्स हैं, कोई बिग शॉट्स नहीं है, कोई कॉन्टैक्ट्स नहीं है, कोई पॉलिटिकल वो नहीं है, कोई रिचेस नहीं है. अकेले हम लोग नहीं फेस कर सकते मॉब. इकट्ठे रहेंगे तो टिकेंगे, नहीं रहेंगे तो one by one we all go.
Are you ready to lead something? Doctor, are you ready to lead?
Ma'am, you asked me? Yes, ma'am.
See, the question is, let me be very frank with you. You have got an expertise in creating self-help groups. You know exactly what has to be done. You have to come down and, we arrange IMA meeting, another meeting, and only genuine people who want to be part of it can be done. And, you can just tell, what are challenges you feel and this is what it is. And I think, you have to see to it that, you are ready to spend something like 1 hour every day, on this particular work. And I think it will be tremendous help for the community in Delhi. And let's set an example. I was really thrilled when Dr. Divya told me, Doctor, हमारे पास तो ये 300-350 का ग्रुप है. आप बता रहे 450 लोग हैं, तो इससे तो बढ़िया. Yes, it means you can already lead.
Ma'am, actually, I'll be happy to do it because, ma'am, practice तो चली रही है और चलती रहेगी. I mean, survive करेंगे तो practice करेंगे ना. So we all together. So ये तो करना ही है. There's no other way to it. Or I would really love.
I will say our leader is Anupma Gupta and Divya Singhal. As far as self-help groups are concerned, back out nahi hona hai, and this we will do it, and you will have full cooperation from me and my team and local teams. We have to see to it that they will extend full cooperation. And I feel ki this has to be done. If this is done, people like me are going to give you the best award as far as Delhi Gynecologist Forum is concerned. I think the biggest award can be, Dr. हम लोग पिटना नहीं चाहते. मैंने उस लड़के को देखा, महाराष्ट्र के लड़के का, उसके कपड़े फिरे हुए, मुझे समझ ही नहीं आया कि क्या करना है.
मैम एक्चुअली मैम फिजिकल की भी बात नहीं है. मैम 48 इयर्स के बाद, आई एम 48 इयर्स हूँ, उसके बाद आपका प्राइड, आपका जो सेल्फ प्राइड का एक आयोटा बाकी है वो खत्म हो जाता है. आपने जो जरा सा कॉन्फिडेंस रह गया है काम करने का वो खत्म हो जाता है. इट कैन बी सो डेरोगेटरी. सी मैम, मेडल की तो बिल्कुल बात नहीं है बिकॉज इस ग्रुप का मेन मैसेज यही था कि ये पॉलिटिकली इंक्लाइन नहीं रहेगा. डोंट ट्राई टू पॉलिटिसाइज दिस. यहाँ पे वोट नहीं मांगना है हमको सिर्फ.
Doctor, let me be very frank with you. I'm in this particular game for the last 20 years. And मैंने जो litigations Delhi Medical Council में आती हैं और वो third page बन जाता है, you know, everybody is discussing about Shakuntala, about everybody, you know. You know, it's a talk of discussion. जैसे एक मीडिया में discussions होते हैं ना, उस तरह से हम लोग discussion करते हैं. Help नहीं करना चाहते. So I have seen you helping your fraternity helps. Today I've got a stature today is all because of helping in medical legal cases only. But मेरे पास इतना effort नहीं है कि जी हम लोग यूना के self help group बना लेंगे. उसको तो डॉक्टर साहब, मैडम गुप्ता, आपको करना पड़ेगा, दिव्या को करना पड़ेगा, local leaders को करना पड़ेगा. And those people have to come forward that, you know, things have to be done. Because this is the need of the hour. मुझे I know it कि जो आदमी legally suffer करता है उसका जो अपना सेल्फ इमेज है, इट बिकम जीरो. उसको अपने आप ही ग्लानि आने लगती है कि ये क्या हो गया मेरे साथ. एंड यू हैव टू put them the thing, and उनके साथ we tied over, talk to them on an everyday basis. This can be done only for, you know, 50 people in the whole city. We can't be doing for the litigation of other things with us, because that becomes very difficult. Each person who has suffered a litigation requires 50 hours of counseling. It requires 50 hours of counseling. Morning, evening, afternoon. उनको बाहर निकालना अपने cocoon से. But I think, you know, this is a very challenging task, and that's why I asked you, Anupma, are you ready to lead?
Yes, ma'am, I'm ready to. And I would just need your guidance, and we are ready to do it.
I will ask Shakuntala and to come out with the different teams. Divide out teams between the Divya and yourself कि आप कौन सा एरिया लेना चाहते हो. ईस्ट दिल्ली लेना चाहते हो, जो नॉर्थ तो ऑलरेडी है इन लोगों के पास, हमें वहाँ काम नहीं करना. जहाँ काम नहीं शुरू हुआ वहाँ पर आपने काम शुरू करना है.
ठीक है.
Sure.
So I think, you know, it has been a very fruitful meeting, and this is what is the need of self-help groups. किसी को कोई कमेंट करना मैडम को.
मैं फिर से वो एडमिनिस्ट्रेशन की बात फिर से कर रही हूँ, क्योंकि 2 बार हो चुका है ऐसे कि एक जगह एक स्टिल बर्थ हुआ था, and the people, we rang up the administration, means the medical superintendent and the administrator of that hospital, not the other doctors, the HOD. While we were explaining it is a stillbirth, that person ऐसे हाथ रख के ऊपर हाथ रख के, मरा हुआ बच्चा तो पैदा हो ही नहीं सकता. They think it was crawling out of the body or something, और वो तुमने मारा है उसको बाद में. So तो वहाँ जनरल वार्ड सामने था, वो सारे इकट्ठे हो गए, वो शोर मचाने लगे. When they started breaking the hospital window panes and everything, then the OT technician and all called them. तब वो भागे आए. डॉक्टर के सपोर्ट में कोई, they should have some responsibility for the doctor. The hospital.
Let me be very frank with you. Dr. Sharda Jain cannot enter in the premises of big hospitals.
No, as a general rule.
We talk about individual clinic, 5 to 10 bedded hospital, and let's limit our limitations to them. उनके पास सारी muscle power है, उनके पास सब तरह की power है. Let's not dilute our things for that. मेरी आपसे खाली एक sincere request है, and you can see Dr. Raj also folding hands, that please become empowered legally. Do the course. This course is for 30,000 rupees, and I will request we'll reduce it to 20,000 rupees, but everybody should do it. One thing, we will see to it that this course fee is reduced, and each one of you should do it. And secondly is that, you know, please come forward. एक आपने हेल्प करने के लिए एक जज्बा होना चाहिए कि हमने एक दूसरे को हेल्प करना है. अगर आप नहीं खड़ोगे तो कल कोई दूसरा भी नहीं खड़ा होगा. मेरे पिता एक बात कहते थे, शारदा शादियों में जाना या नहीं जाना, पर तेरे जनाजे में ना 500 लोग खड़े होने चाहिए. इतना काम करना.
नहीं डॉक्टर साहब, जो आपने बोला है ना, ये मत सोचना कि दिल्ली गायनी फोरम का जो ऑब्स्टेटिकल क्रिटिकल केयर कोर्स है, हम लोग जबरदस्ती लोगों को बोल रहे हैं इसको करने के लिए. नहीं, ये ना मैं
पीजीडी की बात बता रही हूँ. पीजीडी एलएमएस की हमें लीगली भी डॉक्टर एम्पावर होना है.
नहीं डॉक्टर साहब, एक तो ये है कि हम ये नहीं बोल रहे हैं. दूसरा कहते हैं ना, बूझो तो जानो।
नहीं डॉक्टर साहब, क्रिटिकल केयर कोर्स इज सो गुड, ईच एंड एवरीबडी शुड डू इट।
नहीं, और
मैं कहती हूँ ये दोनों कोर्स को आई विल सी टू इट दैट वी विल नॉट इंक्रीज द फीस, एंड यू नो इट शुड बी डन बाय एवरीबॉडी।
आई टोटली एग्री। दूसरा, हम लोग उसको 5 बार, मतलब तीसरा हमारा टाइम चल रहा है,
5 बार करेंगे डॉक्टर साहब?
नहीं डॉक्टर साहब, मैं इनको ये बता रही हूँ कि 3 बार तो हम, थर्ड हमारा कोर्स चल रहा है। हम लोग खुद जो सारे सीनियर लोग हैं, एक बार रिकॉर्डिंग कर चुके हैं, एक बार रिकॉर्डिंग सुन चुके हैं, उसके बावजूद भी 100% क्वेश्चन के आंसर नहीं दे सकते।
डॉक्टर साहब, हर बार मॉड्यूल के पहले हम 3 बार कोर्स करके बताने के बाद मेरे नंबर जो है 90% से ऊपर ही नहीं आते।
और दूसरी बात ये है कि जो इसको ना पैसे से नहीं तोलना चाहिए किसी को, चाहे कोर्स हो, चाहे ये प्रिवेंटिव जो मेडिको लीगल है, जो हमारी मेडिको लीगल हेल्प है, इसमें किस दिल्ली गायनी फोरम का कोई पर्सनल एजेंडा नहीं है।
एंड मेरी
Absolutely.
के मेंबर बनो और डीजीएफ के मेंबर बनो। आप सोचो एओजीडी आपको मदद करेगा? कभी नहीं करेंगे वो। उन्होंने एक रिमार्क नहीं बोलते डॉक्टर।
नहीं, आई थिंक खुद जरा सबको खुद खड़ा होना चाहिए।
ये दोनों कोर्सेज आपने करने, ये वाला काम आपने करना है। और प्लीज, आवर लीडर इज अनुपमा गुप्ता।
अनुपमा, आप दिव्या आप अनुपमा के साथ मिलकर हम सबकी हेल्प करो।
बिल्कुल, हम करने को तैयार हैं। डॉक्टर राज बुकारिया, can you please elaborate on the medico legal course? Somebody wants to know from the chat box.
नहीं, वो हम सारा पूरे सारे कोर्सेज का आपको इन्फॉर्मेशन
डॉक्टर साहब, we will have a one more meeting. I think tomorrow is Dr. Shashi Kabra is here.
She has just left.
अच्छा, शशि काबरा से मैंने रिक्वेस्ट किया था। डॉक्टर साहब, आई वाज आस्क्ड बाय द IMA फॉर्मर एक्स प्रेसिडेंट कि डॉक्टर साहब वो सुप्रीम कोर्ट में इसको केस को लेके जा रहे हैं, डॉक्टर शर्मा के केस को, एंड दे वांटेड समथिंग टू बी रिटन बाय ऑन द PPH. So today I posted it by Dr. Mane, myself and Dr. Shashi, that give them a material so that they will make a concise thing about this. The basic idea is to say that anybody low risk patient can also have PPH and die of PPH. So what I told Dr. Mane that that she should take a class. मैंने आज शशि से बोला था, शशि please arrange a class on PPH, जो intricacies जो है, why death occurs in such patients. She probably will arrange at 7:30 and my request is there that at least this particular
कल 7 बजे है डॉक्टर साहब, कल 7 बजे। अभी 7 बजे, हाँ मेरे को उसने 7 बजे लिखा था।
ठीक है,
ग्रुप में डाल देगी शशि, सबको
कंफर्म हो जाए तो ग्रुप में, क्योंकि डॉक्टर साहब एक बात बिल्कुल क्लियर है, we must have a knowledge, we must know the law, we must form self help group. अगर आपने ऑब्स्टेटिक प्रैक्टिस करनी है तो डॉक्टर साहब ये सब काम,
मैं ना बिल्कुल ठीक बोल रहे हो। मैंने भी इसकी कभी वैल्यू इतनी नहीं समझी थी जब मैडम आपने मुझे सुबह 8 बजे फोन करके बोला था, तो मैंने कहा था कर लेंगे, मतलब मैं झूठ नहीं बोलती, जो सच है वही बोल रही हूँ। तो मैडम ने बोला तो मैंने कहा हाँ बिल्कुल करना है, करेंगे। लेकिन ऑनेस्टली बता रही हूँ, करने के बाद पता चला, डॉक्टर लीना इज सिटिंग देयर फ्रॉम दैट, शी इज how much hard work has gone and how much we have learned from that.
And can I just add, Dr. Angela, when you mentioned about the critical care and the medical legal, I think these are complementary courses. Yeah. Because एक तरफ आप you acquire all the skills to tackle, on the other side you know the law. Because it's so very clear that if we don't know the law, we don't know what is civil negligence.
Doctor, we are 100% empowered after the law.
Yes, absolutely, ma'am. And now we feel so confident because we know criminal negligence क्या होती है, civil negligence क्या होती है. We know the MTP Act through and through, again and again. And then of course with critical care we'll know how to handle.
नहीं, इसलिए ना मुझे लगता है कि देखिए डॉक्टर साहब, पहले तो ये सारी चीजें ऑफलाइन होती थी, तो हर जगह जाके नॉइज पोल्यूशन, रास्ते का पोल्यूशन, हमारे सबको बहुत दिक्कत होती थी, हम लोग दूर दूर नहीं जाते थे। बट जब से ये जूम शुरू हुआ है, आई थिंक वी शुड टेक एडवांटेज ऑफ इट, देयर इज नो हार्म। इफ सम
अंजिला, आपने साउथ दिल्ली में डॉक्टर मैडम के साथ, IMA के साथ मिलके मैडम अनुपमा गुप्ता को सक्सेसफुल,
डॉक्टर साहब अब तो अपनी मीनाक्षी को उसको पकड़ेंगे ना, मीनाक्षी विल हेल्प अस आउट,
प्लीज प्लीज प्लीज।
नहीं, बिल्कुल बिल्कुल।
I think it had been a very fruitful meeting. Sum up कर दीजिए डॉक्टर दिव्या।
यस मेरा बस एक लास्ट मैसेज
मैडम हम तो बहुत सारे टॉपिक्स लेकर आए थे, लेकिन आई थिंक द डिस्कशन हैज बीन एब्सोल्युटली वंडरफुल। आई मीन हम कभी और ये केसेस दोबारा से करेंगे किसी और सेशन में।
ऐसा बस एक मैं लास्ट कह रही हूँ कि ऐसा हमारे साथ किसी के साथ भी ये प्रॉब्लम हो जाए कि आपके सामने मॉब है, आपको थप्पड़ लगा दिया किसी ने या कुछ कर रहा है, तो अपना इमोशनल स्ट्रेंथ मेंटेन करके रखें, अपनी स्वाभिमान बना के रखें, अपने को कभी भी गिरा हुआ मत महसूस करें, कभी भी गिल्टी मत महसूस करें कि मेरे साथ ये क्या हो रहा है। आई हैड टू सी दिस डे, सो यू हैव टू फाइट इट आउट, यू हैव टू बी टफ। थैंक यू सो मच।
एक is है preventive medico legal consultancy. All of us have taken it, but you know initially 200 people had given their names and finally we could enroll only 60 people. शुरू में तो उनको लगता शायद लड्डू मिल रहे होंगे यहाँ पर, but जब एनरोल करने की बात होती है 60 people only enrolled it. मेरी आपसे रिक्वेस्ट है कि this preventive medico legal consultancy is very good. Two of our neighborhood people had a problem. And you know we consulted Dr. Gitendra definitely was, जैसे मैडम ने कहा कि सब आपका दिमाग बंद हो जाता है तो सब दिमाग खुल जाता है डॉक्टर साहब। तो फिर जो उनके 2-3 असिस्टेंट है उस जो पर्सन सफरिंग है उसके 2-3 असिस्टेंट होते हैं जैसे हमारे जैसे लोग, फिर हमारे को ही खुलता है कि पुलिस को इन्फॉर्म करना है, इसको इन्फॉर्म करना है, इसको इन्फॉर्म करना है, एंड थिंग्स आर टाइड ओवर यू नो। सो आई थिंक यू नो दैट इज आल्सो इक्वली इम्पोर्टेंट। अगर आप एक केस में भी बच गए ना डॉक्टर साहब तो थिंग्स आर विल डेफिनेटली गुड। मुझको तो डॉक्टर साहब डॉक्टर गुप्ता की बात लेके अच्छा लगा कि मॉब भी चली गई और उसको लिटिगेशन भी नहीं हुआ।
नहीं, और दूसरा ये अपने ऊपर हम लोग, मुझे लगता है कि एक को फीमेल को देखकर एक तो मॉब उसको सुनाता भी बहुत है यू नो, और प्लस हम वी टॉक अबाउट ब्रेकिंग द बायस, वी टॉक अबाउट वुमेन एम्पावरमेंट, उसका रिजल्ट तभी आएगा कि जो आपको कोई धमकी ना दे सके।
चलिए, I think it has been a very fruitful meeting.
Yeah, thank you.
Thank you, ma'am.
Thank you.
All because of you.
और RS से बिल्कुल डरना नहीं है। मैं ये सबको PPT भेजूंगी।